All right, so we did anteriors. Now we're going to be doing lower left lingual. And since this is a mandibular section or a mandibular area, we want to make sure that our patient is semi-supine. So semi-supine, lower left, we can have the patient turn a little bit towards you to help out. And you are going to be using some direct, mostly direct vision, but maybe to get around the distal surface, you might need your mirror to illuminate the area and to also so we can see inside and get that distal lingual surface. So I'll try to keep this really short because it's already a long video, and I will show you the surfaces on my picture. Now to show you the correct working end, this would be the wrong working end because it's not standing up and over the tooth. It's going across horizontally, which we don't want. So we want to flip it and make sure that our probe is actually going up and over. So if you can see that angle of up and over. And then we want to make sure that we start at the distal buccal line angle, and we want to take oblique strokes. And oblique strokes, I will show you my pen grasp in a better positioning. Oblique strokes, and we want to roll into the distal, and we want to cover 51%, so we're able to fill all the calculus in there. And then we can go ahead and flip our tip to the other direction towards mesial, start at the distal buccal line angle, and then we want to take oblique strokes as. All right, so one more time, we want to make sure we have the right working end. We start at the distal buccal line angle, and then we want to take oblique strokes, and we want to roll into the distal. We want to flip the tip of our instruments, and again, we want to take oblique strokes. We want to roll into the mesial surface. And I'll show you my modified pen grasp up close. Checking in with our modified pen grasp, we want to make sure that we have our correct working end now. You want to make sure you have your light C, you have your tactile sense middle finger, and then you have your fulcrum. For posterior, it helps to telescope your instrument out. So you might need to make sure that you're a little bit further out. And then as you work into more anterior surfaces, you can kind of inch up and then make sure that you're a little bit closer. So again, you can telescope out to reach all the way back there, or you can pull it in closer to make sure that you are able to get everything. That's my modified C. Lastly, we're going to be doing the upper right lingual surface. So you're going to be sitting 10 to 12. Your patient is still supine, and you will definitely be using indirect vision. So you are using indirect vision on that one, and I will show you up close what that looks like. And when you're working on the upper right posterior lingual surface, it's all indirect vision, so I thought I would demonstrate indirect vision. So this is how I would see it in the mirror. Again, to find the right working end, this is the right working end because, again, it's going over the tooth. This would be the wrong working end because it's going across the tooth. So I want to make sure that I am starting at the distal buccal line angle, making oblique strokes, rolling into the distal. Of course, I have my mirror to illuminate and to make sure I can see. And then I want to make sure I flip it, start back at that distal line angle, distal buccal line angle, oblique strokes as I roll into the mesial. And the next tooth, distal buccal line angle, oblique strokes into the distal.